3, camera ready. 2, 1.
Here's what's coming up today on The Doctors.
The new feeding tube diet.
Total loss, 32 pounds.
Is this quick fix just throwing money down the drain?
Fast is usually not the best approach for food, but what about this fast approach to weight loss?
It's called the KE diet or the feeding tube diet.
I've tried dieting on my own. I've tried exercising, but it's a very, very long process.
Chris is now making what some say is a drastic choice to finally get rid of the weight.
Perfect. We're done.
A feeding tube is inserted into the patient's nose and down to their stomach. It's the same procedure to keep someone in a coma alive. A patient gets 800 calories a day. A constant drip of fluids keeps you full throughout the duration of the diet. Dr. Oliver Pietro is the only doctor in the United States that offers the procedure, partly because other health professionals are against the diet. Dr. Pietro says he is aware of how extreme the procedure is. He says he only performs it on patients who are severely overweight. He calls it their kickstart at a new life. Despite the inconvenience, the diet worked for Chris.
I lost 23 pounds during this diet. I think I'm going to be doing it until I feel comfortable with my weight.
And you don't feel like it's extreme what you're doing?
It is extreme, but also it is high time to do it.
Joining us now in the front row is Jeanette Lee, who recently tried this diet herself. Plus, we have Dr. Oliver Pietro, who founded this diet. And, Jeanette, I'm going to first ask you this. Now, I'm going to ask you how much weight you lost, because you're going to lose weight on that. How much weight have you gained since you went off of it?
I gained 5 pounds, but the reason why I gained pounds is because I went to vacation directly right after it. I've done 2 cycles. The first time I did it in April, and I haven't gained any weight from there on. So.
You said you've done 2 cycles.
I've done 2 cycles.
And,
I did
and total all with
total
the 2
loss,
cycles?
32 pounds.
32 pounds.
And 4 dress sizes.
This is kind of what you're carrying around all day long. And are you wearing it in the backpack that it comes in? Or you put it in your
can do
purse?
the backpack. I did a purse.
You did a purse.
So I did a purse, and that worked for me.
Man, I'm losing my appetite just looking at it.
With a nasogastric tube in, mind you, because Janelle, I'm only challenging you because you work at a spa that offers this, right?
Yes, I work at Novapuds in Houston, and we're the first people that offered it in Houston. Yeah, and I was the first one to try it out.
And you enjoyed having a tube down your nose?
I mean, I wouldn't say enjoyed it, but yeah, I mean, I wanted to lose weight, so it was something that was
Dr. Pietro, I'm gonna ask you this because a lot of people, look, there are a lot of different ways to lose weight, right? Certainly, this is one way to do it. You know, another way, you could take a piece of duct tape, tape it over your lips. I mean, a lot of ways to lose a lot of weight really quickly. You can wire your mouth shut. We've had people on the show who've done that before. Here's the reality. In my humble opinion, and I want you to challenge me if you can, every study looks at people. If they lose weight the right way, then they can potentially keep it off. But over the long term, people who lose weight the wrong way, for instance, developing a negative relationship with food by putting a tube in, obviously you're going to lose weight. But, I mean, come on, you're walking around with a backpack and a nasogastric tube in, and you're charging people $1,600 for 10 days. I think it's
I
absurd.
understand the concept of a kickstart, but it's how you're doing the kickstart. I mean, you're essentially doing a controlled starvation. And I know you have set guidelines. It's only for people that meet certain criteria, obese people. Well, what you're saying is it's okay to starve really fat people. I mean, it's...
and charge a lot of money. Doesn't work. I mean, go ahead, and obviously, yeah, people are going to lose weight, but isn't this really just a money-making scheme?
Well, first of all, it is not. But what I'd like to say is everything you're saying is true. This diet is intended as a jump start. It doesn't keep the weight off. We only intend this to be an option to weight loss doctors, to have this as an option to get weight down very, very quickly. But they have to do something afterwards. We tell every patient. That's why we limit. We now have 10 centers in the U.S. doing this. They're all weight loss specialists, you know, obesity medicine specialists. They're board certified. These are doctors that dedicate their entire practices to weight loss. So they use this as a rapid weight loss of 1 to 2 pounds per day, and then they go into another program that they deem
you just said you're really offering it at weight loss clinics, but I know, Jeanette, you work in a spa.
Well, no, it's a medical weight loss.
It's a medical...
Yeah, we're
she has a physician that has come to training, that has learned it. We create a state of profound nutritional ketosis. And that's why it works.
Jeanette has already done 2 cycles. How many cycles are you going to have her go through? I mean, like, do you have a quota as to how many times you're going to put someone's body through this process?
Well, that patient that you saw in that segment, doctor, he has done 9 cycles and has lost over 100 pounds. He's very, very happy. And that's over about a year.
I mean,
so we could create weight loss that is comparable to that seen with bariatric surgery. So I think it's a very powerful weapon in this war against obesity.
I totally disagree. And here's why. Because you've cycled it, that guy, for instance, on 9 cycles of this, the minute you stop cycling him, he'll gain the weight back. He will. Yeah. It's inevitable. And I'll tell you, I'm going to challenge you again because I could also put you in a state of ketosis, not charge you $1,600 for 10 days and say, okay, eat an egg for breakfast, eat some mixed nuts in the mid-morning, eat another egg for lunch, some nuts here, take a multivitamin and another egg for dinner. You're going to be at about 800 calories. You're going to go into ketosis. You're going to lose the same amount of weight. And at least you don't have an NG tube in and carrying around a backpack and paying $1,600.
Dr. Pietro, I mean, we've used this formula, this technique in getting patients ready for high-risk surgery if they're really overweight. But typically that's been done in the hospital setting. I have concerns about, having people walking around, going through the day on such a low caloric count, looking at a lot of potential issues they could have getting sick. I'm not sure if letting them go through this in an uncontrolled setting is safe.
Well, doctor, it is controlled. They get called every day. They get blood tests twice during the treatment. They come in 3 times a week. They are followed by the doctor. The nurse calls them every day. Experience has shown we've done well over 300 patients so far.
And how many cases of aspiration pneumonia or
0
illness have you had?
The Europeans have published 19,000 patients that have done this 2.5 cycles average, 57,000 times. Not one case of aspiration pneumonia, not one death, not one complication.
But any diet that's extreme like this where you need to have your blood tested twice during the first 10 days, look, I will give you one area where I think this could be useful. If you have a morbidly obese patient who's bedridden, then absolutely, I would not argue with this approach one bit. But no offense, I look at Jeanette here, who works at a spa that now offers this, and I see you as someone who, if you're incorporating new lifestyle measures to eat healthier, then I applaud you.
And she's gorgeous. Can you imagine her walking into the mall with this
I don't
thing
look at you walking around
and
with
this in her purse? I mean, like, Jeanette.
But you don't see it in my part. I weighed 189 pounds. I mean, I am short. I'm 4'11", so I look like a ball.
Well, and this isn't arguing, though, about weight loss. Look, we all believe that people who are overweight, who want to lose weight, yes, there's no magic bullet. There's no magic pill. A lot of different ways to lose weight. Some ways are good, some are bad. And I just think this is a bad way to lose weight. That's just my humble opinion. But again, there are situations, bedridden patients, where I do think, Dr. Pietro, this would make some sense. But the social stigma of walking around, I mean, literally, in your nose, walking around with a backpack, oh, yeah, I'm on this awesome diet. This is really a lot of fun. I'm really creating a great relationship with food right now.
Man, it's making me gag just thinking about it.
And, generally speaking, NG tubes are for people who really don't have a choice, who are really sick. And so the idea that we would pay $1,600 to walk around in a state that normally very sick people walk around in is quite extreme.
Or something.
And I have a great friend who's got a great diet book that can really help you lose weight the natural way. Because going through extremes like this for $1,600 for 10 days, which will get you about 10 or 15 pounds of weight, and then you're going to gain 5 to 10 pounds of those back the next week, is way too extreme for my taste.
And we recently have done some things on our show where we talk about the real deal or not. There are all these miracle diet pills. There's all these miracle supplements. And if nothing else, I think what we want to just relay to everyone watching is that there is no miracle. And wearing a backpack with an NG tube is also not a miracle. If you don't learn the tools, even people who go through gastric bypass surgery, at least they are learning the tools of portion size. And I will say the one thing, Dr. Pietro, I will give you is, I do know that you're also teaching people tools. And that is where I will support what you're doing, because you're trying to teach people how to eat healthier. I don't think you have ill intent here. But $1,600, That's a lot of money for 10 days, because I know a lot of people who've lost 10, 20 pounds in a couple of weeks enjoying it. And they don't have to spend that money on good food. That's enough to feed your family for, I mean, come on, months, right?
Months there, yeah, right.
So if you have an eating problem, and our country does, we talk about it all the time, the solution is in modifying what we're doing there. And obviously we have a long way to go, but you have to understand, on a show like ours, we can't sit here and be like, okay, you know what, it's cool, everyone in America, we're just going to wear backpacks and have NG tubes, and it's going to be sweet, and none of us are going to have any disposable income because we're spending it all on these NG tubes. So I hear what you're saying and appreciate it, and it is a big issue. It's a huge issue. But there's a difference between the majority of people, right, who are just looking, they're trying to figure out a way to lose 10 pounds. And I am willing to bet that this is a diet that is people are like, oh man, I need to lose 10 pounds. Like, let's just do this. Let's lose it. Let's put the NG tube in and go for it. Yeah. And what I'm challenge you is, the minute that NG tube comes out, those people are going to put that weight back on and then some if they don't learn the tools.
That's not true. If you continue with a bariatric physician that has you on a weight maintenance program, you will not put it back. If you go back to the way you were eating, yes, you'll gain it back. This is an innovative way
to handle
now, Dr. Travis, I'm a lot older than you, but I remember when Botox came out and when bariatric surgery came out. You know, most doctors were against it. Now we all embrace these things as a normal part of medicine.
Well, no way we're going to get on the board of embracing NG tubes with vitamins for people who just need to lose 10 to 20 pounds.
In 5 years, this will be embraced by most weight loss specialists. The president of the American Society of Bariatric Physicians, one of the most respected institutions in this country, is chair of our scientific advisory board because we're studying this. We're doing clinical research. We're doing it the right way, and we're proving clinically that this is safe and it's effective, doctor. And you think what I used to think before I did my homework, and I guarantee you in 5 years, this will be available in hundreds, if not thousands, of weight loss.
Come back in 5 years and we're going to tell you the same thing about the NG tube vitamin diet.
All right. Please proceed.
Certainly do appreciate you coming on and sharing your stories with us, so we do appreciate it.